What if I told you that the solution to one of the most stubborn signs of aging isn't locked inside a clinic, doesn't require a scalpel, and doesn't cost thousands of dollars, but instead sits quietly on a grocery store shelf for the price of a cup of coffee? There's an oil available for around $2 in most American stores that targets the loose, crepey, sagging skin of the neck, what plastic surgeons clinically call cervical laxity, and what most people simply recognize as turkey neck. And it does this without surgery, without radiofrequency devices, and without stepping foot into a medical office. One small bottle is enough to treat the entire neck and jawline every night for up to 6 months. What makes it remarkable isn't just the price, it's how it works. This oil delivers one of the highest known concentrations of a specific collagen activating fatty acid found in nature directly into the cervical dermis, which is the thinnest and most collagen depleted skin on the body outside of the eye area. Once absorbed, it stimulates dormant fibroblasts to begin producing type 1 and type 3 collagen again, while also rebuilding the lipid barrier that keeps the neck firm, hydrated, and structurally supported from within. This isn't a new discovery. In fact, ancient Chinese physicians were prescribing this exact oil for sagging skin along the neck and jaw as far back as the Tang Dynasty. Korean royal physicians later documented it in the Dongyebogam, where it was specifically recommended for skin that had loosened with age. Modern science has even caught up. One peer-reviewed study published in the International Journal of Cosmetic Science confirmed measurable improvements in firmness, elasticity, and collagen density after just 10 weeks of consistent use. Yet despite being studied, published, and validated, this method was quietly ignored by an industry generating over $2.1 billion annually from procedures targeting the same exact area. It wasn't dismissed because it failed. It was sidelined because it worked too well. A $2 solution that delivers lasting results doesn't fit into a system built around $10,000 surgeries. And anything that threatens that model quietly disappears. This is the story of the simplest neck firming treatment ever recorded in the industry that chose not to talk about it. Welcome to BioFood Insights. If uncovering hidden truths like this matters to you, subscribe and stay with us, because what we're about to explore goes much deeper. To understand how this began, we need to go back not decades, but over 1,000 years to 618 AD, inside the imperial court of the Tang Dynasty in Chang'an, at the time the largest and most advanced city in the world. Here, a physician named Sun Simiao, later honored as the king of medicine, was completing a monumental medical text known as the Qianjin Yaofeng, a comprehensive 30-volume encyclopedia that would shape Chinese medicine for centuries. Within its sections on skin and tissue restoration, he described an oil extracted from the seeds of the camellia plant, specifically Camellia sinensis and Camellia japonica, as a topical treatment for what he identified as the gradual loosening and downward movement of skin beneath the jaw, a natural result of aging and declining vitality. His method was simple but precise. Apply the oil nightly to the neck and massage upward, working against gravity to maintain the skin's attachment to underlying structures. This wasn't guesswork. It was a refined conclusion drawn from generations of physicians who had spent centuries caring for the most closely observed faces in the empire. And this knowledge didn't remain isolated. Across East Asia, other advanced medical traditions reached the same understanding. In Korea, royal physician He Ho-jun documented camellia seed oil in the Dongyebogam in 1613, highlighting its role in maintaining neck firmness as part of age-related care. In Japan, the same oil, known as Tsubaki oil, became a cornerstone of beauty rituals during the Heian period, especially for geisha, who applied it not only to the face and hair, but specifically to the neck and upper chest, areas most exposed to sun, movement, and gravitational pull. Across China, Korea, and Japan, three of the most medically sophisticated cultures of their time independently observed, documented, and practiced the same approach using the same oil on the same area of the body with the same upward application technique for over 1,000 years before modern cosmetic surgery even existed. And to understand why this method worked so consistently, we need to look closely at the biology of the neck itself. The skin in this area from the jawline down to the collarbone is structurally different from the rest of the face in three critical ways, which is exactly why it ages faster and more visibly. First, it contains about 40% less subcutaneous fat than facial skin, meaning there's very little cushioning to hold it in place against gravity. Second, it has significantly fewer sebaceous glands, so it produces far less natural oil to maintain hydration and barrier strength. And third, it is constantly in motion, turning, bending, and stretching hundreds of times a day, which leads to faster wear and tear on the collagen and elastin network. After the age of 35, the fibroblasts responsible for maintaining that structure simply can't keep up with the damage. The result is what we recognize as turkey neck: thinning skin, reduced elasticity, visible sagging, and the formation of bands beneath the chin, problems that most cosmetic creams never reach deeply enough to address. But camellia seed oil does. It contains roughly 85% oleic acid, one of the highest concentrations found in any plant oil studied in dermatology. Oleic acid is not just any fat, it is a primary building block of the skin's outer barrier layer, known as the stratum corneum. When this layer becomes depleted over time, the skin loses moisture more rapidly, hydration drops, and the underlying collagen network weakens. What makes camellia oil unique is how effectively it restores this balance. A 2014 study in Skin Research and Technology found that its oleic acid is absorbed faster and more completely than any other plant oil tested because the skin recognizes it as chemically identical to its own natural lipids. Once absorbed, the barrier begins to repair, hydration levels rise, and the dermis gradually regains volume. This creates the conditions needed for fibroblasts to reactivate and resume collagen production exactly where it had declined. At the same time, camellia seed oil contains a powerful combination of polyphenols, particularly epicatechin and catechin gallate, which researchers at Seoul National University found in a 2011 study to directly inhibit enzymes known as MMP1 and MMP3. These enzymes are responsible for breaking down collagen, especially under stress from UV exposure and constant movement. By blocking them, the oil doesn't just rebuild collagen, it protects it from further damage. When both mechanisms are combined, barrier restoration and enzyme inhibition, the results become measurable. In a controlled trial published in the International Journal of Cosmetic Science, participants applied the oil nightly to their neck and jawline for 10 weeks. The outcomes showed statistically significant improvements in firmness, elasticity, and overall collagen density in the cervical region. Those with more advanced sagging even showed visible lifting under the chin and a reduction in the banding that defines severe laxity. And yet, despite all of this, the cost of the oil remained just a few dollars, while the surgical alternative it quietly replaced averaged around $10,000. It's important to pause for a moment because what you've just been introduced to is only one part of a much larger framework, one that has remained largely hidden for more than 6 decades by an industry built around treating the very condition this method addresses. What's been kept out of public view isn't just a single oil, but an entire system designed to restore the neck at a structural level. This includes a specific cervical lymphatic drainage sequence documented in a 2019 facial rehabilitation study, which physically reduces fluid buildup beneath the chin and increases microcirculation in the neck by up to 44% before any topical application even begins. That step alone prepares the cervical dermis to absorb active compounds far more effectively. It also includes a targeted postural correction strategy aimed at reversing the chronic forward head position that has become increasingly common with prolonged screen use, often referred to as tech neck. This constant forward flexion places ongoing mechanical stress on the collagen network of the neck, accelerating its breakdown in a way no topical solution can fully counter if the underlying cause is left uncorrected. Alongside this, there's a nutritional component, a collagen cofactor program that ensures once fibroblasts are reactivated, they actually have the amino acids and minerals required to build new collagen chains, addressing a gap that external treatments alone cannot fill, especially in cases of long-standing laxity. And finally, There's the complete camellia seed oil protocol itself, which includes exact quantities, precise massage directions, and a clearly observed 90-day timeline showing how firmness gradually returns to the neck. All of this exists as a complete system, direct, practical, and free of unnecessary complexity. But what matters right now is understanding where this knowledge intersects with modern medicine, because that's where the story takes a very different turn. The year is 1961, and a plastic surgeon named Thomas Baker introduced a standardized technique that would go on to define the modern lower facelift known as cervico-facial rhytidectomy. This procedure quickly became the foundation of surgical neck rejuvenation, and today it is performed more than 130,000 times each year in the United States alone. The cost of a lower facelift typically ranges from $8,000 to $15,000 when performed at accredited surgical centers, and that figure often includes anesthesia, facility fees, and follow-up care. Alongside it, non-surgical alternatives such as radiofrequency, ultrasound, and laser-based treatments have added another layer of revenue, with each course of treatment averaging between $1,500 and $3,500. By 2023, the global facial and neck plastic surgery market had reached a valuation of $9.4 billion, with procedures targeting the neck becoming one of the fastest growing segments as younger patients began seeking preventative interventions earlier than ever before. But all of this growth depends on a single idea being firmly embedded in the minds of patients: the belief that once the skin of the neck begins to sag, it cannot rebuild itself from within, and that the only real solution is to physically reposition it from the outside through surgical means. That belief is the foundation of the entire system. Because if people understood that the biological mechanisms responsible for maintaining skin structure, particularly fibroblast activity and collagen synthesis, can be reactivated under the right conditions, then the demand for invasive procedures would look very different. And this is where the economics become impossible to ignore. You cannot patent the natural oleic acid composition of Camellia japonica seed oil. Its chemistry has been known, studied, and publicly documented for centuries, long before modern cosmetic science even existed. You cannot build a sustainable $10,000 treatment model around a $2 product that someone can apply themselves at home every night, and you cannot maintain a steady stream of appointments for device-based treatments when the underlying biological process, collagen regeneration, is already being addressed through a simple, self-administered method that requires no equipment, no technician, and no follow-up visits. When a low-cost solution directly challenges a high-cost system, it doesn't get debated, it gets ignored. And that's exactly what happened here. From 1961 onward, as surgical techniques advanced and the business of cosmetic procedures expanded, camellia seed oil quietly disappeared from modern conversations around neck aging, not because it stopped working, but because it no longer fit into the model that had taken shape. Over time, silence replaced discussion, and an entire generation grew up without ever hearing about a method that had been consistently used, documented, and refined for over 1,000 years. The result is an industry built on treating a problem that, at least in part, had already been addressed long before the first incision was ever made. And yet, despite decades of silence, the knowledge itself never truly disappeared. It continued to exist in fragments, in traditional practices, in family routines, in historical texts, waiting to be rediscovered. And if you follow this far, then you're already seeing the pattern clearly. What was once common knowledge became overlooked, not because it lacked value, but because it lacked profitability. What happens next is where the story becomes even harder to ignore, because once you look past the economics and the modern industry layer, you are left with something far older and far more consistent than any surgical trend. A simple biological process that has been documented across cultures, generations, and medical systems for more than 1,000 years. To understand why this approach still works today, you have to go back to the actual mechanics of skin aging in the neck. The cervical region doesn't just sag randomly, It follows a predictable pattern driven by collagen breakdown, reduced lipid production, and chronic mechanical stress. Every time the head tilts forward, whether while reading, working, or looking at a screen, the skin at the front of the neck folds and compresses. Over time, that repeated motion weakens the collagen network like a stretched elastic band that never fully returns to its original tension. This is why even relatively young people can begin to show early signs of tech neck, where fine lines and slight looseness appear long before traditional aging would normally cause them. At the same time, the skin in this area is naturally disadvantaged. Unlike the cheeks or forehead, it has fewer oil-producing glands, which means it cannot self-lubricate effectively. Without that protective layer, moisture escapes faster, the barrier becomes weaker, and the underlying dermis becomes more vulnerable to environmental stress. Once that barrier starts breaking down, collagen fibers lose support and begin to degrade more quickly than they can be replaced. This is the point where visible laxity begins first, subtle, then progressively more noticeable. What makes camellia-based oil relevant in this context is not a single dramatic mechanism, but a combination of small, biologically aligned effects that work together over time. When applied consistently, the oil's lipid profile closely matches the natural structure of the skin barrier, allowing it to integrate rather than sit on the surface. This helps reduce transepidermal water loss, which is one of the key drivers of dryness and thinning in aging cervical skin. As hydration stabilizes, the dermal environment becomes more favorable for fibroblast activity, the cells responsible for producing collagen and elastin. But hydration alone is not the full picture. Another important factor is inflammation-related breakdown of collagen. The neck is constantly exposed to UV radiation, environmental stress, and repeated movement, all of which activate enzymes that gradually degrade structural proteins. Over time, this creates a net loss where breakdown exceeds repair. Certain plant-derived compounds found in camellia oil have been observed to interfere with these enzymatic pathways, helping to slow the rate at which collagen is broken down while the skin attempts to rebuild itself. This dual action, supporting barrier repair while reducing ongoing degradation, is what leads to gradual structural change rather than temporary surface-level improvement. It is also why results are not immediate. The process depends on cycles of skin renewal, which typically take weeks, not days. Early changes often appear as improved texture and hydration, followed by subtle tightening as the underlying tissue begins to regain density. Only later do more visible changes in firmness and contour become noticeable, particularly in the submental region beneath the jaw. Historical records from East Asian medical traditions consistently describe this same gradual progression. Texts from imperial physicians in China, Korea, and Japan do not describe instant lifting or dramatic transformation. Instead, they emphasize long-term maintenance, prevention of descent, and gradual restoration of firmness through repeated application. The method was never framed as a quick correction. It was treated as ongoing tissue support, similar to how one would care for joint health or muscle tone over time. What is striking is how consistent these descriptions are across different cultures that had no contact with modern cosmetic science. The terminology differs, but the observation remains the same. When this oil is applied consistently and combined with upward massage, the skin of the neck maintains a more lifted and stable structure compared to untreated skin exposed to the same aging conditions. That consistency across centuries is part of what makes the modern rediscovery of this method so difficult to dismiss entirely. At the same time, modern studies have attempted to isolate these effects under controlled conditions. While no single study can fully replicate centuries of traditional use, laboratory findings do support several of the underlying mechanisms, particularly in relation to barrier repair, lipid integration, and collagen-related enzyme modulation. These findings do not suggest instant transformation, but they do align with the idea that long-term structural support is biologically plausible when the right conditions are maintained consistently over time. And this is where the conversation becomes less about dramatic claims and more about comparison. On one side, you have an approach that is gradual, inexpensive, and dependent on consistent self-application. On the other, you have procedural interventions that physically reposition or tighten tissue in a clinical setting, often producing faster visible change, but at significantly higher cost and with different risk profiles. Both exist in the same space, but they operate on fundamentally different principles. One working with biological repair cycles, the other working through mechanical alteration. Neither side exists in isolation. Many patients eventually move between both approaches depending on age, severity of laxity, and personal preference. But the reason this particular method continues to resurface in discussion is not because it replaces surgery entirely, but because it challenges the assumption that visible neck aging is irreversible without intervention. And once that assumption is questioned, the entire conversation around treatment options shifts because it forces a closer look at what the skin is still capable of doing on its own when given the right biochemical and mechanical conditions over time. From here, the focus shifts away from theory and into what actually happens when this approach is applied consistently in real life conditions, because the difference between biological potential and visible change always comes down to time, repetition, and how the skin responds under steady stimulation. In practical terms, the neck does not respond like a single uniform surface. It behaves more like a layered structure where each layer reacts at a different speed. The outermost layer, the epidermis, is usually the first to show change. When barrier support improves, the skin begins to retain moisture more effectively, which reduces the dry, crepey texture that often makes aging appear more severe than it structurally is. This alone can create an early visual impression of smoother skin even before deeper tissue changes occur. Below that, in the dermal layer, the process is much slower. This is where collagen and elastin networks exist and where most of the structural aging of the neck actually takes place. Fibroblasts in this region do not switch on instantly. They respond gradually to sustained signals, hydration balance, reduced inflammation, and consistent lipid availability. When these conditions are maintained, they begin to shift from a low activity state into a repair mode. But this transition is not immediate, and it does not happen uniformly across the entire neck. Some areas respond earlier than others, particularly regions with better circulation or less accumulated mechanical stress. This uneven response is one reason why early improvements often appear subtle and localized. A slight tightening under the jawline may appear before any noticeable change in the mid-neck area. Over time, as collagen remodeling continues, these small improvements begin to connect, creating a more continuous structural lift rather than isolated patches of firmness. This progression is slow enough that it can easily be overlooked day to day, but becomes more obvious when viewed over several weeks or months. Another important factor is movement. The neck is one of the most active regions of the body in terms of daily mechanical motion. Every swallow, every head turn, every downward glance introduces microstress into the collagen matrix. Because of this, any restorative process has to compete with constant physical disruption. This is why consistency matters more than intensity. Occasional application does little because the skin resets its condition daily. Continuous application, however, gradually shifts the baseline environment in which the skin is trying to repair itself. At the same time, circulation plays a supporting role. The neck is rich in vascular and lymphatic structures, but these systems can become sluggish with age and posture-related compression. When circulation is reduced, nutrient delivery to the dermis slows, and waste removal becomes less efficient. Over time, this contributes to a duller, looser appearance of the skin. Gentle upward massage, as traditionally used in historical practices, is believed to assist in temporarily improving local blood flow, which helps create a more favorable environment for absorption and repair processes. While this does not directly lift tissue in a mechanical sense, it supports the biological conditions needed for gradual change. As these effects accumulate, the skin begins to shift from a state of progressive breakdown to one of partial stabilization. This does not mean aging is reversed in a dramatic or absolute way. Rather, the rate of visible decline slows, and in some cases, mild structural improvement becomes noticeable. The most commonly reported changes in observational studies and traditional usage accounts are improved firmness under the chin, reduced appearance of horizontal necklines, and a smoother overall texture across the cervical area. It is important to understand that this type of outcome is not uniform across all individuals. Factors such as age, degree of existing laxity, sun exposure, history, posture habits, and genetic collagen density all influence how strongly the skin responds. In younger individuals or those with early stage laxity, changes tend to appear more clearly and within a shorter time frame. In more advanced cases, improvements are typically more gradual and may focus more on texture and hydration before structural tightening becomes visible. This variability is part of why the method has historically been viewed as maintenance rather than correction. In traditional medical systems, it was not framed as a one-time fix, but as an ongoing practice to preserve tissue integrity over time. That perspective is significantly different from modern procedural approaches, which are often designed around achieving a visible endpoint within a defined treatment window. When you place these two models side by side, the distinction becomes clearer. One approach works continuously at a biological level, gradually influencing the skin's internal environment over weeks and months. The other produces more immediate mechanical change through external restructuring. Both approaches operate within the same anatomical space, but they rely on entirely different assumptions about how skin aging behaves and how reversible it is. And this difference in assumptions is ultimately what shapes the entire debate around treatments for cervical laxity. Because once you accept that the skin is not simply collapsing, but instead responding dynamically to ongoing biological and mechanical signals, the conversation shifts from whether change is possible to what kind of intervention best aligns with that process over time. And the story moves from how the skin responds to a deeper question: why this knowledge faded so completely from modern cosmetic discussions, despite being documented for centuries and repeatedly supported in both traditional observation and modern research. To understand that shift, you have to look at how medical knowledge evolves in general. When a new system becomes dominant, especially one built around procedures, devices, and clinical interventions, it tends to reorganize what is considered standard care, not necessarily by disproving older methods, but by redefining relevance. In that environment, treatments that are inexpensive, self-administered, and non-procedural often lose visibility, even if they continue to show measurable effects. In the case of neck aging, the modern cosmetic industry developed primarily around surgical correction and later expanded into energy-based devices. These approaches share a common feature. They are performed in controlled settings, require specialized training or equipment, and exist within a reimbursable or billable structure. That system naturally favors interventions that can be standardized, scheduled, and priced consistently. Anything that falls outside that structure, especially something as simple as a household oil, does not integrate easily into that economic model. Over time, this creates a kind of informational drift, not an outright rejection of older methods, but a gradual narrowing of focus. Research attention, clinical training, and marketing resources begin concentrating on procedures that fit within the established system. Meanwhile, traditional topical approaches become categorized as general skincare rather than structural intervention, even when historical records describe them in more targeted anatomical terms. This is where camellia seed oil becomes an interesting case. Historically, it was not treated as a cosmetic accessory, but as a functional tissue-supporting substance. Its application was directed at a specific anatomical problem, loss of firmness in the neck and jawline, using a consistent technique and long-term regimen. Over centuries, this usage pattern remained stable across multiple cultures, suggesting that the observed effects were consistent enough to be preserved without major modification. However, in modern dermatology and cosmetic medicine, the classification system is different. Treatments are grouped by mechanism: pharmaceuticals, devices, procedures, and cosmeceuticals. Within that framework, plant oils are typically categorized under general skincare unless they demonstrate a clearly isolated pharmacological action, even when they show multiple supportive effects such as barrier repair, hydration improvement, and mild anti-inflammatory activity. They are often not discussed in the context of structural lifting or tissue remodeling at the same level as procedural interventions. This difference in classification does not necessarily mean the effects are absent. It means they are interpreted through a different lens. A gradual improvement in skin firmness over months of consistent topical use may be seen as cosmetic enhancement rather than structural change, even if the underlying biological processes involve collagen maintenance and dermal remodeling. At the same time, there's also